Today I'm going to talk about the death of late Sunjay Kapur, who was the ex-husband of Bollywood actress Karisma Kapoor. On 12th of June, Sunjay Kapur was playing Polo in London. And while he was playing Polo, all of a sudden he collapsed. The last words which he did utter was, he swallowed something. So what is swallowed? And everybody thought that he might have swallowed some insect. But the fact is, he swallowed honeybee. A bee is swallowed. So now the question is, how can ever a person swallowing a bee, can ever a person die? Yes, indeed, indeed. That is what we call it as the Kounis syndrome. So in this particular Kounis syndrome, once a person swallows the bee, the bee contains a venom, and the venom is transferred from the body through the sting to the surface where it bites. So the venom contains nearly around zero point 0.3 milligrams of venom present in each bees, and these venoms are present in the abdomen of the bees. And these venom glands, once it stings, the venom is injected, and it contains nearly about 60 components in that bee, and a lot of enzymes are there. And these enzymes are the one which provoke or trigger so-called inflammatory reactions in the human body. And this inflammation reactants, and the commonest thing, so we call this thromboxane and platelet aggregating factor or platelet activating factors. This is the most important thing. Plus so many enzymes which are released as a result of this venom inside the human body. And these inflammatory mediators, which activates the mast cells and so-called biogenic amines which are released, and these biogenic amines trigger the coronary spasm. This is what is the most important in this particular beasting, and especially the so-called Kounis syndrome. This coronary spasm can lead to the sudden death of the individual because it blocks the blood supply to the heart, leading to ischemia. Besides, the platelet activating factors, the thromboxane which has been released as a result of the bee sting, and this itself can lead to the formation of so-called thrombosis. So acute thrombosis that can lead to the blockage of blood supply to the heart vessels, causing the death. So beside this, these inflammatory mediators also cause respiratory distress. There may be some edema or swelling at the site of the bite, inflammation, redness, pain, and release of so-called secretion from the glands. If it's from the respiratory, the mucosal glands, the respiratory enzymes. So all these things lead to respiratory distress. So the person, once there is a bee sting, which happened in case of Sunjay Kapur, he swallowed the bee. During his swallow, and this particular sting which might have stung the respiratory passage or maybe the esophagus, which has triggered the mast cells activation, leading to production of inflammatory mediators, thereby leading to respiratory issues where there is difficulty in respiration. At the same time, it has also led to so-called coronary spasm or the formation of acute thrombosis, leading to ischemia and death of the person, so-called the coronary syndrome. So the bee sting triggering the coronary syndrome and respiratory distress, which culminating in the death of the individual, which is sudden in nature. So the whole process we call it as so-called the Kounis syndrome. So this is the possible cause of death in Sunjay Kapur, who swallowed bee during the is when while he was playing polo. And above all, I would like to assure that in all cases of sudden deaths, though the circumstances suggest that the possible, because the last words he said, Sanjay Kapur said was, he swallowed something, he swallowed an insect. So this is the only possibility in which the Sanjay Kapur has died. However, in all cases of sudden death, the standard protocol do suggest that all natural diseases has to be ruled out and all poisonings has to be ruled out, all any unnatural causes have to be ruled out before we conclude in those causes of death which I discussed now. Thank you.